trainers.
Hey, welcome back in. I'm really excited now because I have different information that I didn't know as a parent. So I'm about ready to learn with you. As summer nears the end, some sports are starting their practices, and every athlete knows recovery is so important. It's key. Here with me right now to share what parents need to know before they take their kids to any athletic trainer is Beth Miotke, the Community Health Network athletic trainer for Metropolitan School District of Lawrence Township. It's so good to have you.
Thank you for having me.
Yeah, I think it's interesting because I said, what is the number one thing that you would want us to get out of this segment? And it is the exact opposite of what I was taught as a parent. So let's just start at the beginning. You say the most important thing is the relationship between the school and the trainer and the parents.
Yes.
Tell me about that.
So being able to have good open communication is the most important. If parents can divulge good past medical history to us, whether it's their kid has asthma or diabetes or pre-existing heart condition, you know, if they're struggling with something at home, if there's food insecurities, anything like that, it's going to affect the health and performance of their child when it comes to athletics.
When is it that part of like what I was taught is that students need to be able to talk to the athletic trainer, parents need to stay out of sports, they need to back off. That's not what you say should be happening.
No, I think it's really important to make sure that the parents are communicating with the athletic trainers as well as their children are communicating with us. That way we can help provide the best possible care that we can.
Yeah.
Sometimes kids don't pay attention and
Yeah.
sometimes kids just don't know what they don't know.
Right.
So having the parent communicate well is what allows us to perform our best job to help their children.
Is the best way to do that, do you think, always is through an email? Back and forth, or
Email,
do you set up a
honestly,
time? I mean, I know
love
you guys
phone
are
calls.
busy. Okay.
Even if a kid comes in and says, my mom wants you to call him. Okay, what's a good time? And I'll make it happen.
Okay, let's do that. What do you think that you hear the most, or like right now? I mean, I'm thinking of the sports that are, you know, high schoolers are out right now. They've been training and they've been out in the hot sun and they've been doing maybe some cases, you know, practicing for hours a day. What do you think it is the number one thing that parents are asking you, or the thing that they need the help with the most, do you think?
I think something that helps a lot is making sure that they're helping their kids not only stay hydrated, eating properly with good nutrition, and sleeping. You know, keeping a good pulse on what their kids are doing to help make sure that they're staying safe and healthy is one of the easiest ways to help prevent injuries from happening.
It's so interesting that you bring that up because sleep and the food are two of the things, are at least when we're talking about high schoolers, are not doing well.
No, they're not.
And it's something that can help them so much. How do we get our kids, do you think, to want to understand that a little bit more about, wow, you can really feel so much better and perform so much better if you just do those two things?
I think sometimes it's hard to get the kids to buy into it, but sometimes it's hard to get the parents to buy into it
Yes.
too. So yeah, I think just making sure that some of what we do is just education.
Yeah.
You know, we teach them why it's important, and it's something that we preach daily at Lawrence North to all of our sports. So hopefully sometimes they sinks in a little bit and we can help out a little bit.
I love that. And do you think there is, speaking of just athletic trainers, is there a, you know, maybe a injury that's kind of you're seeing more often now, or not? Is it kind of across the board, kind of the same things that you always have, or is there something that's like, you know what, we're starting to see a lot of blank?
You know, there's kind of what we call an ebb and flow.
Okay.
You know, there's some years where you have a little bit more muscle injuries. There's some years where you have more concussions, sadly. And sometimes it's more broken bones. It's just kind of a random, but we kind of see a little bit of everything, to be honest.
That's kind of what you're still seeing.
This is what we still see.
So good to see you. But again, I learned something today. I love it when I learn something. It is okay for parents to reach out to the athletic trainers and to have a conversation.
Absolutely.
Thank you.
Thank you for having me.
Yes,
I appreciate it.
wish I would have known it then. That's 9:19.